Moving on to leukocytes, or our white blood cells. So these are going to be our least abundant formed elements, totaling only about 5,000 to 10,000 white blood cells per microliter, yet we cannot live very long without them. Um, they're easily recognized in stained blood films because they have a conspicuous nucleus that will light up um, violet to dark purple in most of the common blood stains, so they're going to be the easiest things to point out. And they are much more abundant in the body than their low number in the blood films would suggest, because they spend only a few hours in the bloodstream, then migrate into the connective tissues and spend the rest of their lives there. As outlined in the beginning of this chapter, there are 5 kinds of leukocytes, and they're distinguished from each other by their relative size and abundance. Here is a quick structure of a white blood cell. And the first type of white blood cell that we're going to talk about is going to be a granulocyte. They are called this because they have various kinds of specific granules that stain conspicuously and distinguish each cell type from others. Neutrophils are the most abundant white blood cells. Generally, about 4,000 of these consist about 60 to 70% of circulating leukocytes. The nucleus is clearly visible in these, and in mature neutrophils, they typically consist of 3 to 5 lobes connected by slender strands, but you don't have to know too much about that. Aggressively antibacterial, so numbers increase in bacterial infections. You'll see a bunch of neutrophils if there is a bacterial infection because they battle those, right? So you got a bacteria infecting you, you're going to see a bunch of white blood cells. Specifically, neutrophils attack that, and they phagocytize bacteria and release antimicrobial chemicals, so they can destroy the bacteria in multiple ways, but we will not talk about that until chapter 21. Then we have eosinophils. So they are harder to find because they're only about 2 to 4% of white blood cells, averaging about 170 cells per microliter. They are in the mucous membranes of the respiratory, digestive, and lower urinary tract. They have 2 large lobes connected by a thin strand in cytoplasm. Has an abundance of the coarse rosy to orange colored specific granules. They secrete chemicals that weaken or destroy relatively large parasites such as hookworms and tapeworms. Too big for any one white blood cell to phagocytize. And they also dispose of inflammatory chemicals, antigen, antibody complexes, and allergens. So foreign antigens that trigger allergies. Allergies, parasitic infection, diseases of the spleen, central nervous system can cause an elevated eosinophil count called eosinophilia. And these counts also fluctuate greatly from day to night, seasonally, in women with phases of the menstrual cycle, etc., etc. And we move on to basophils. So they are the rarest. They average about 40 cells per microliter and usually consist less than 0.5% of the white blood cell count. So 1 in 200 cells. They can be recognized mainly by the abundance of coarse dark violet specific granules in those different sides. The nucleus is largely hidden from view by those granules, but it's large, pale, and typically S or U shaped. They secrete 2 chemicals, both of which you've heard of. Histamine, which is a vasodilator that widens the blood vessels, speeds the flow of blood to an injured tissue, and makes the blood vessels more permeable so that blood components such as neutrophils and clotting proteins can get into the connective tissues more quickly. And heparin, so an anticoagulant that inhibits clotting and promotes the mobility of other white blood cells in the area. They also release chemical signals that attract eosinophils and neutrophils to a site of infection. And here they are in microscope form. Then we move on to agranulocytes. So we start with lymphocytes. They are second to neutrophils in abundance and are quickly spotted when examining on a blood film, which we'll see a picture of. They're 5 to 17 micrometers in diameter. They range from smaller than red blood cells to 2.5 times as large, and they're sometimes classified into 3 size classes, but there are gradations between them. Lymphocytes are usually going to be seen in the fibrous connective tissues and only occasionally in the circulating blood. They're seen in blood films, mostly in the small size class, and they're sometimes hard to distinguish from basophils. They're going to be a little bit more packed, whereas basophils are going to be a little bit more conspicuously grainy. They are sometimes difficult to distinguish from monocytes as well. But lymphocytes are going to be round and slightly dimpled on one side and usually pretty dark violet. The cytoplasm is going to be more abundant with medium and large sized lymphocytes. But collectively, their importance is in cell destruction, specifically cells that have been infected with viruses or cells that have turned malignant, and different foreign cells, including parasites that have been introduced into the body. So they secrete different chemicals that communicate with other white blood cells and coordinate action, and they can present antigens to active immune responses, and they can give rise to the cells that secrete antibodies, providing more long-term immunity to pathogens. And we move on to monocytes, the largest white blood cells seen on a blood slide. So they're usually 2 to 3 times the diameter of a red blood cell, and they average around 460 cells per microliter and are about 3 to 8% of the white blood cell count. So the nucleus is going to be really large, really visible, often relatively light violet. If you're looking at a slide with more of a kidney-shaped or horseshoe-shaped nucleus. The cytoplasm is going to be abundant and contain sparse fine granules. Monocytes go to work only once they leave the bloodstream and transform into large tissue cells called macrophages or macrophages, however you want to say that word. I've said both, I think, in this presentation. And then macrophages are highly phagocytic cells that consume dead or dying hosts and foreign cells. They are the big eaters. Macro, big, phage, to eat. And they consume as much as 25% of their own mass per hour. So that's proportional to a person eating 35 pounds of food per hour, if you want to scale up like that. They also chop up and process foreign antigens, and they display fragments of them on the cell surface to alert the immune system to the presence of that pathogen. Thus, they and few other cells are called antigen-presenting cells, APCs. The function of macrophages are going to be further detailed once we get to chapter 21. And here are some examples. So the lymphocyte, you see how it's really packed, really dark violet, and then the monocyte with its U-shaped nucleus and its very, very large size in comparison to the red blood cells that are surrounding it. Now we move on to leukopoiesis, so the production of white blood cells. And it begins with the same hematopoietic stem cells, the HSCs, as erythropoiesis does. Some HSCs differentiate into distinct types of colony-forming units, right? Those CFUs that we were talking about earlier, that go on to produce the following cell lines. Myeloblasts, monoblasts, and lymphoblasts. Myeloblasts, which ultimately differentiate into 3 types of granulocytes, the neutrophils, the eosinophils, and the basophils. The monoblasts, which look identical to myeloblasts but lead ultimately to monocytes, and then the lymphoblasts, which produce all lymphocyte types. Circulating white blood cells, they don't stay in the body really long. Granulocytes leave in 4 to 8 hours and live another 4 to 5 days. Monocytes leave in 20 hours. They transform into macrophages and live for a few years. And then lymphocytes actually provide our long-term immunity for decades, being continuously recycled from blood to tissue, fluid to lymph, and back to the blood. Here's a good picture of everything we just talked about. So our HSC to our CFUs, our precursor cells to our mature cells. So the total white blood cell count's normally 5 to 10,000 white blood cells per microliter. A count below this range, and we call it leukopenia. This can be seen in lead, arsenic, mercury poisoning, radiation sickness, and such diseases like measles, mumps, chickenpox, polio, influenza, typhoid fever, and AIDS. It can also be produced by glucocorticoids, anti-cancer drugs, and immunosuppressant drugs given to organ transplant patients. Since white blood cells are protective cells, leukopenia presents an elevated risk of infection and cancer. Conversely though, a count above 10,000 white blood cells per microliter is called leukocytosis, and this usually indicates the presence of infection, allergy, or other diseases, but can also occur in response to dehydration or emotional disturbances, believe it or not. More useful than a total white blood cell count is a differential white blood cell count, which identifies what percentage of the total white blood cell count consists of each type of leukocyte. So, leukemia is a cancer of hematopoietic tissues that usually produces an extraordinarily high number of circulating leukocytes and their precursors. So leukemia is classified as myeloid or lymphoid, acute or chronic. Myeloid leukemia is marked by uncontrolled granulocyte production, whereas lymphoid leukemia involves uncontrolled lymphocyte or monocyte production. Acute leukemia appears suddenly, progresses rapidly, and causes death within a few months if not treated. And then chronic leukemia develops more slowly, and it can go undetected for up to years. Chronic lymphocytic leukemia is so slow to develop that doctors often opt not to treat it at all, but just pursue a course of watchful waiting. Both myeloid and lymphoid occur in acute and chronic forms. The greatest success in treatment and cure has been with acute lymphoblastic leukemia, the most common type of childhood cancer. Treatment uses chemotherapy and marrow transplants, along with the control of side effects such as anemia, hemorrhaging, and infection. As leukemic cells proliferate, they replace normal bone marrow, and a person suffers from a deficiency of normal granulocytes, erythrocytes, and platelets. So even though enormous numbers of leukocytes are made and spilled over into the bloodstream, they don't actually provide that usual protective function of the white blood cell. So they're like an army of children present in vast numbers, but too immature to perform an actually useful defensive role. So the deficiencies of competent white blood cells, they leave patients vulnerable to opportunistic infections. So the complete blood count includes the hematocrit, hemoglobin concentrations, total red blood cells, reticulocytes, white blood cells, platelets, differential white blood cell count, red blood cell size, hemoglobin concentration per red blood cell.